Hello, everybody. Welcome. Thank you so much for joining us today. I'm Patricia Trudeau with the HR Roundtable. Very excited today to have Clare Rosché Matzzie with us from Safer Public Health. She's here today to help us learn more about how HR leaders can help our teams reopen safely during this very challenging time that we're all dealing with. Clare is a public health consultant that's been dedicated to helping businesses keep their teams safe and productive during COVID-19, now as well as into the future. She has over 15 years of experience as a clinician and public health professional. She's an associate member of the American College of Occupational and Environmental Medicine. Occupational and Environmental Medicine. As the pandemic began, Clare did realize that business owners and human resources professionals were being asked to become public health experts. So she started Safer Public Health to help. You hire a lawyer for legal advice and an accountant for accounting, and you can hire a public health professional to develop your COVID safety plans and protocols to keep your team safe. Clare helps businesses keep your team safe and productive during the COVID-19 pandemic. We're so excited to have Clare with us today. Did want to ask that if you have any questions, please feel free to put them in the chat. We want this to be certainly a very interactive experience. She's got a great presentation for us, but please do let us know as you have questions, and we'll definitely do our best to get to those. Let me go ahead now and turn it over to Clare.
Thank you so much, Patricia, and thank you to all of you for joining us today. I'm really looking forward to having an interactive meeting with you all. I will share some of my information, and you all will have the opportunity to share some of your experiences of where you are in your process of bringing your teams back together and how you plan to do that safely. I will share my intro screen, but I'll give people another maybe minute or two to hop in. Let's see. And again, as we go through, there will be some specific opportunities to ask questions, raise hand, interact, but also as questions come up, you can toss them in the chat and we'll get to them either on the slide that pertains to that, or when we get to more of the official question and answer section. So let's see, where are we? Looks like a bunch of people are popping in, so I'll give people another moment to join us. All right, I think we're ready, Patricia? Excellent. All right, good morning, everyone. At least I'm assuming it's morning for most of you, unless anyone's joining us from Europe. My name is Clare Rosché Matzzie. I'm the Principal Public Health Consultant for Safer Public Health. I want to send a special thank you to PJ for bringing us all together today. This is such an important topic, and I've really enjoyed working with my HR professional colleagues during this time period. Usually the HR person, the person who just wants my PTO sheet or whatever, but the people I've worked with through this pandemic have given me a special appreciation for human resources professionals, because you are literally the people taking care of the human resources of your organizations and our communities. So I'm so grateful for you to join us. Your teams are lucky to have you because you're taking time out of your Friday to join us. So thank you so much. All right, this is me. I'm Clare Rosché Matzzie, Principal Consultant with Safer Public Health. I have about 15, almost 16 years of experience as a clinician. I'm a primary care physician assistant, newborn babies to grandmas. I've worked in community health, especially in Washington, D.C. and Maryland. And this past year, about a year ago now, I was sitting at this exact same desk, seeing patients via telemedicine. And I'd get patients every day calling me from their place of work with COVID symptoms or exposure. And I realized we were in a situation where employers, HR professionals, and the general public was all of a sudden being expected to become public health experts in a virus that nobody was an expert on yet, right? So I realized that I could use my expertise, take some additional trainings with the American College of Occupational and Environmental Medicine, that are kind of more workplace safety and COVID specific than I've been doing up to that point, and get out there and help businesses keep their teams safe. So this is such important, topic that we're all working on today. And this pandemic has evolved so much over the last year. So businesses are really taking this opportunity to keep our team safe. Of course, here's your fine print. I'm not a lawyer. This is for educational purposes. This information is not a substitute for medical or legal advice. It was for informational, educational purposes. And I just want to make sure to share that so that we are all on the same page as far as that's concerned. Thank you. All right, let's see. How are we doing? I think we're okay to go ahead and get started properly, right? Okay, great. All right, so start with the plan. So here's our plan for today. We're going to just review some basics so we're all on the same page about, what's COVID and how we can prevent the spread. And then more specifically about how employers and HR leaders can keep their employees, their guests, their customers, their clients safe. All right. And of course, we'll discuss those specific situations that HR and employers are facing as the pandemic evolves. We'll troubleshoot some of those. And then, of course, the reason a lot of you are here, the vaccination question. What are we going to do? All right. And then, of course, we'll discuss what I can do as a consultant to help you all. Again, you all are HR leaders and experts. That does not mean you're a public health expert in a virus that has only been around for just a little over a year. So as PJ said, you hire a lawyer for contracts, an accountant for taxes. You can also hire somebody for this, probably the most important document and protocol and plan you'll come up with, this year. So that's what we'll talk about today. All right, this is just an infographic of, the current state of the pandemic, number of cases per 100,000. So this is just to say that while numbers are improving significantly, there's still COVID out there, especially in certain pockets, and we all have to continue to work together to keep our team safe. Now, here's Washington, D.C. I'm happy to say that on May 3rd, there were 0 deaths in DC documented from COVID-19. That was such a milestone to show that with vaccination and appropriate safety protocols, we really can get through this as a country and as a community. There were similarly in Maryland, there was a couple days this week where there were no documented COVID-19 deaths. So we're not down to 0 yet. If you look at that curve over here, we're not down to 0 cases yet. Because we had such a high peak after Christmas and in the new year, but we're really improving with increased vaccinations. We're getting there. There is hope. There is light at the end of the tunnel. All right. That being said, we still have to be careful, just to make sure we're on the same page. COVID is airborne. Either small droplets, big droplets. Probably not on surfaces, but it's good to wash your hands anyway. So you might as well just keep that in mind. When you're working on your prevention protocols. And of course, the masking. How do we keep from getting COVID? We mask, we wash our hands, we stay home if we're sick. And then we get vaccinated. All right. All right. So that was just a quick review of some basic science, where we're coming from. Why don't we take a quick moment to break out? Or PJ, should we wait just another minute to break out? You think we have enough people to go ahead and do that, or do
we can absolutely do the breakouts.
Okay, let's do the breakout room. So you have 2 conversation starters, and then you guys will come back and you can pick someone to present to the group about what insights came up in your group, or you can toss in the chat, whatever works for you guys. But question 1, what are you most concerned or most anxious about when you return to the office, both personally and professionally? All right. And then 2, what are you most looking forward to when you return to the office? So why don't you guys when you're in your breakout rooms, just take a moment to discuss, like, I'm really worried about my pandemic puppy, or, oh, I'm really looking forward to eating my favorite coffee shop, but what's in your heart right now? What are you thinking about your next steps and when you go back to the office?
All right. Okay, Claire, everybody should be back.
All right, so what did we come up with, friends? You can either raise your hand or put it in the chat. Like, if what were things people were anxious about, weighing on them a little bit?
I'll go first.
If you see somebody raising their hand, I can't see. Oh, Ms. O?
Yep. One of the things that I brought up in my group is that our facilities at one point in time pre-COVID were open to the public. And so knowing how to manage that while keeping our community safe as well as our staff safe is something that we actually haven't even explored yet, but it's going to be something of a big concern for us.
Yeah, absolutely. If you have sort of you have your office-based team, but it's, you know, front-facing or open, you know, workplace, that makes a big difference because you can control your employees to a certain extent, but the public, it's a little harder to, you know, ask for their vaccination card every time they walk in the building, you know.
That is a good question, Claire. How do you handle that when you have visitors come into the space? If you are an employer that perhaps does have a vaccine mandate, how do you go about addressing that with people that come in, clients, people visiting?
So for the next few months, and I would honestly recommend, unless it's mission critical, I wouldn't allow visitors in the workplace until maybe October, even December, unless, of course, you know, if it's visitors and consultants that can be dealt with virtually, better to continue doing that for a while. But of course, if you're retail or medical and you obviously have to interact with your clients, you know, if it's a regular patient of like a medical facility, you'll generally have access to that sort of information, or at least be able to ask for that sort of access. Otherwise, it's another reminder that even with vaccines, we need to keep masking up, you know? So I think decreasing the exposure by limiting the number of people in the building in period, whether it's employees or clients or customers or consultants or you know, contractors, limiting the number, and then maintaining as many precautions as you can for those people who are not employees who do not have all that vaccination information. All right. School closures, no daycare or lack thereof is concerning, right? So, you know, a lot of people have lost their support systems for their caregiving roles, either for elderly parents, kids, or pandemic puppies. So that could be very anxiety provoking, especially midsummer. You know, hopefully in the fall, schools are going to be reopened relatively normal. So honestly, that's what I'm recommending most to my clients, unless they're otherwise obliged to go ahead and make their goal for reopening. Because people have, it's hard to shift. When you have to sign up for summer camp in January, it's hard to tell people in May that they have to come back in June who have either, you know, some sort of dependent or caregiving role. And then some people have more concerns, just like the basic nuts and bolts of how many people can we fit in our space, or public transportation. Yeah, that's a concern. All the more reason to get vaccinated and mask up. So people want to, you know, looking forward to the office interactions, those kind of dynamic meetings that you don't plan, but you run somebody in the hallway and say, oh, I was thinking of you, we should do this. So that's great. Anybody else want to chime in about what they talked about, what they're anxious about or what they're looking forward to? Zoom fatigue. Right, so we will probably still be doing some Zooming if we have employees who are staying virtual, or if we're, you know, decreasing our travel. So we might be having meetings with clients on the West Coast, or, you know, the whatever opposite coast virtually. So it might be a different kind of Zoom fatigue, right? As we're like having an in-person meeting, then, oh, wait, is that a Zoom or an in-person? Oh, you know, we'll have to juggle that a little differently and manage that a little differently. All right, and then the vaccines. We'll definitely address some of the vaccine questions as we continue this presentation. All right, I think I might go ahead and keep going, but keep going with the chat. You know, this is exciting. These are exactly the questions that we're going to talk about today, and have opportunities to learn from each other. All right, let me get back to sharing. All right, friends, move you all to the top so I'm looking at you. All right, so those are questions that, of course, come up. We'll address some of those. All right, so we talked about the basics of COVID, how you keep from getting it. So what is our role as HR leaders, as business owners, as employers? So as we were all discussing, the pandemic changed the way we do business. And we, as HR professionals, business owners, have to, you know, figure out a way to keep our teams safe while still doing business. So how do we do that? we make a plan. All right, so what should a plan include? Oh, wait, I get to ask you a question again. Here's a quick poll. What is the status of your workplace plan? We're already open, we don't really have a plan, or we maybe have a bit of a plan. B, we don't have a date for reopening or a plan. C, we have a date for reopening, but no plan. We have a plan, but no date, you know, kind of see where we are as far as the group, you know, do we have zero plan, some plan, or a completed plan? All right, looks like we have a mix. All right, so looks like we have a mix, but most people have sort of a plan in the works, but haven't quite gotten to their date and their final plan yet. All right, I appreciate, and it's interesting, only 6% of you are you know, mostly open. So this is the right audience for our conversations today, because we can help you kind of go with a plan. PJ, can they see the results, or should I share those?
Already done, shared them.
They see them, okay, great.
Yeah, they were looking at them while
All
you
right, so it looks about 41% have a plan in process, but haven't quite decided on the final date or the final plan. Excellent. I'm going to close the poll then. Okay. I think I will close the poll. All right. PJ, can you close the poll, please? Is that
Yep, all
not
done.
letting me? Oh, there we go. I got it. All right. So what is our role as employers and human resources leaders? All right. We communicate with our employees. We have, you know, frequent interactions with our employees in which we can recommend masking or require masking, or recommend safe choices, or recommend vaccines. We've, you know, we're in constant communication with our team members. We are in charge of infrastructure. We can help design the office space to be safer. We can make sure there's better ventilation. You know, the executives and the HR team is in charge of culture. Do we have a culture of safety, of wellness? Or is that somewhere we need to work on? And, you know, as employers, we have some authority. We are able to require certain, you know, behaviors from our employees, such as masking, testing, and vaccination. We have, you know, so we have a unique position in the community to help decrease the spread of COVID-19, both for our individual employees and for our community. All right. So this is a graphic you may or may not have seen before. It's an infographic often used in the occupational environmental medicine world, basically describing different levels of control to decrease the risk of an injury or an illness. Kind of the classic injury prevention protocol for, say, a more industrial workplace might be, you know, a slip and fall from a ladder. Okay, so we compare that to COVID prevention. So the hierarchy of control starts with the most effective. Eliminate the risk. So in the slip and fall, yeah, if you can make it so that that person does not have to get on a ladder, great. That person's not going to slip and fall from that ladder if they're not on that ladder in the first place. Similarly, to prevent a workplace transmission of COVID, you can do remote work. If they're not in the office building or not interacting with people as part of their work, that decreases the risk of a workplace illness. All right. And then there's engineering controls. Those are the more technology and, you know, infrastructure and hardware that protects folks. So an engineering control for the slip and fall from the ladder might be a better quality ladder, or, you know, other, or making the tools safer. With COVID-19, we're talking about shields, ventilation, which is very important, and then separating the workspaces, okay? Administrative controls. I think for us in this group, that's where a lot of the opportunity is, all right? Creating policies and protocols and screening and communications that communicate expectations about, you know, safer workplace choices and more policy and protocol requirements. And then of course, everybody knows the word PPE. I don't know if people knew that word before a year ago, unless you're in the healthcare field, but now we do. The personal protective equipment. In our slip and fall guy, yeah, that helmet is what prevents like the, head injury from that slip and fall. For COVID, we're talking about masks, gloves, and then face shields, and then vaccines, because that's like your last line of defense. Once the person's fallen, we're keeping the head from getting injured. Once there's COVID in the workplace, you've got all these extra protocols to keep it from getting to another person, right? And also asking people to take those kind of protocols in their day-to-day lives as well is another slightly more subtle issue to discuss. All right. Another way to look at pretty much the same information is that you want to have multiple levels and layers of safety protocols in place so that if something slips in past your first layer of, say, the screening questionnaire, because they haven't gotten symptoms yet, and a person who's been exposed to COVID ends up in the office, oh wait, but everybody's masks and everybody's spaced out. We've got MERV 13 filters. You kind of layer on the protection, sort of like having seatbelts plus airbags, right? So layers of protection decrease the risk of workplace infection. So it's just, important to understand that masks are not the only step. Vaccines are not the only step. They're part of a bigger plan. All right. So this is just a case study of like an example of a situation that comes up with my clients. Organization Y has 127 employees. To protect their team, they converted to nearly 100% remote work in March of 2020. They managed to remain productive through the pandemic. They even grew, hiring 17 new employees. And this has happened to a number of organizations. Their human resources officer would like to have a meeting to welcome these new hires. So they've got a bunch of people who've been working for this company, haven't even set foot in the workplace, and things seem to be getting safer. So let's try to have a meeting. And so they can meet their executive team. What do you think she should consider when planning this meeting? You can either shout out, raise your hand, or put your answers in the chat. Oh, sorry. All right. I'm going to change my view a little bit so I can see you all. So what do you guys think? Is there, what should this human resources leader consider when trying to plan this meeting? What do you think? I like it. Okay. Open air event. I love it. Multiple people who at outdoor events require masks. Praneet put Zoom meeting. That could still be the safest option, depending on where you are and what the status in your area is. That could absolutely still be the safest option, and probably still is. Excellent. All right. Everyone's comfort level, of course. And the idea of a survey or really understanding people's comfort level has come up multiple times over today. See who's been vaccinated. Absolutely. And I think as we move forward, things like meetings may end up still be like a bit hybrid. Like if you've got 17 new hires, but one lives in California and is anxious about getting on an airplane, I think a lot of meetings are still going to at least have an option for a virtual participation. I think that should be kind of pretty much an expectation moving forward, because who knows, some important person in that meeting might have a household member who gets ill that day and has to, call in virtually that day. Or as I mentioned, somebody who has to travel, but it's not safe at a given moment in history, those are important things to keep in mind. All right, let's see what I thought. This definitely covers a lot of what I was discussing. So local COVID-19 prevalence. There's, different parts of our country are really, having different levels of COVID spread right now. So keeping that in mind, or keeping in mind if people are traveling from high prevalence areas to low prevalence area. Is that something you want to happen right now? Are the people vaccinated? Are they comfortable traveling? Outdoor and masked and distanced, even if you're not vaccinated, is a pretty safe group, as long as, it keeps the group reasonably small. Maybe those 17 people should split into two groups of, 9 and 8, just to keep it even smaller. as people continue to get vaccinated, it is a game changer. I would be comfortable having a group of even 17 vaccinated, masked people outside. There's all the different factors that you keep in mind. As long as you have like 3 out of the 4 is sort of my rule of thumb. Some people have been talking on the news, like Dr. Wen, about, 2 out of 3. I'm a 3 out of 4 kind of person. If you're outdoor, masked, vaccinated, and distanced, there's your 4. If you've got 3 out of 4, you're still probably pretty safe. Then food, you will not find me at any buffets for a very long time. It's not even that the food could get contaminated. That's not been considered a vehicle. But you got people bunching up. Oh, I'm trying to get to the oysters. Oh, I want to get to the quiche. You get people jumbled up into a closed space, potentially unmasked, so they're kind of in the middle of trying to get their food. So those little things, or making accommodations to make sure people can participate virtually. Those little details that planning a meeting can bring up, which are kind of nice, actually. If you consider planning a meeting before the big back to office, can be a good kind of trial run, a bit of a pilot program. It's like, okay, did we do a screening? Did we test people? Did we check on vaccinations? What did we do? All right. Did we mention making a plan? I think one of the most important steps is to have a clear plan that is comprehensive, that allows people to know the expectations. Because what do people get anxious about? The unknown. What's going to happen? I can tell you from experience, my two daughters attend 2 different elementary schools. One of the schools had multiple experts in public health on their team, making a very specific, clear plan that we had access to right away. Whereas my other daughter's plan was basically finished 2 weeks after they were already in person. I wonder which setting I felt more comfortable sending my daughters into, right? So I think part of our role is to come up with a plan that people can understand and feel safe, right? So I think, it's when you're afraid of the unknown, if you have a piece of paper that can say, okay, so what's going to happen if I get the sniffles? I will call Miss Shawn, okay? Like people can know what's going to happen as opposed to, I'm scared, I don't know what's happening. So what things should be included in the plan? A vaccine policy. Don't worry, we'll get to more about vaccines. Office capacity limitations. Those will depend on your state and local regulations. Though honestly, most of us are not using our full capacity, even when we have our full team of people, because that's like an engineering qualification. We're not usually sticking our employees in, 2 shoulder to shoulder even before time. So changing an office space, ventilation, making sure we're getting MERV 13. I don't have a full slide on ventilation, but people have specific questions. We can talk about that later. Getting people before they enter the office by screening them for any exposure or symptoms. Masking, avoid congregating, just close off that lunchroom if you would. People can go one at a time, pick up the food, get out, get in, get out. All right. Cleaning workspaces, is still important, even if it's probably not a COVID risk, still appropriate. Just general cleaning, especially if you're doing hybrid model and some people are changing desks, from day to day. That's the situation that's come up. And then cleaning throughout the day, I think beginning and the end of the day is perfectly reasonable, unless you have multiple people using the same desk on the same day. Okay. We do not need to spend $1 million on Clorox wipes. Okay. It's still important to wipe down the surfaces, but as we learned more, for example, Montgomery County Public Schools don't necessarily have to be closed on Wednesdays for deep cleaning, but when we didn't know as much, it became part of the culture of let's wipe down our groceries kind of thing. It's not as important. It's probably still good for other viruses. Let's be honest. Nobody's gotten flu this year almost. So there are some lessons we'll learn from this that hopefully will keep us healthier as we progress. And then again, the plans for protocols, for travel, for meetings, for remote work. So-and-so moved to Ohio. What are we going to do about that? Can we accommodate that, or do we need them to come back? And then protocols for hopefully not, but if a patient or an employee gets exposed either at home or at the workplace, or actually becomes infected with COVID-19, having a plan for what's going to happen then is important. So you're not panicking when it does happen, right? You want to have a plan So you bring out your little paper. Okay, what do I do? Right? As opposed to panicking and, calling me, which would be fine too. All right. So cleaning throughout the day, your own desk, I'd say beginning and the end of the day, coffee machine, copy machine, door handles, etc. Probably beginning and end of the day would be fine. Maybe beginning, end of the day, lunch, beginning, lunch, end would be perfectly fine. Because guess what? Y'all should be washing your hands a lot anyway, right? So the surface becomes less important if you're already masked and washing your hands. Because part of the surface problem is if you touch the door handle and touch your face, guess what? You're wearing a mask. It's gonna be a little harder to touch your face and get those germs in there. So we're dealing with adults here. I mean, if they're educational organizations, we can talk about schools and stuff in a sidebar, but in general, we're talking about kind of adults we need to encourage to wash their hands. And you can put up fancy signs. I actually didn't put a lot about like signage, but again, we talked about communication. You all have a captive audience, right? You're like, put a sign by the coffee maker, wash your hands before and after touching me. Sign, by the front door, or even hand sanitizer right by the front door. So if people touch their door handles, they can sanitize right after. Paper towels next to the front door so they can do the grab the handle with the paper towel trick, create an environment that promotes safety without causing indoor air pollution with Lysol everywhere. So great. I think we got some of those. All right. So, and this will come.
Another quick question about when would be the point that we would be able to open the lunchroom for even a limited capacity? When do you see us getting back to that point of being able to have more of those types of arrangements?
Yeah. So different organizations have different lunchroom sizes, layouts, and capacities. A number of my clients, they have pretty large office space. The actual lunchroom is relatively small. It's not like a place you sit. It's not like a full cafeteria. Some of you all are from pretty large organizations. You might have a full size cafeteria in your organization. I could see you could probably have people like one or two folks at a big, table, kind of staggered, maybe not right in front of each other, but staggered side to side. I can see that working when you have a larger space where the airflow, if you have windows you can open, all those factors can come into play. But if you just got this little space where people just kind of hang out next to stand-up tables, shoulder to shoulder having their coffee, that's going to be harder to keep safe because people are taking their masks down to eat. That's why that's why the lunchroom is a special situation where even if you've got all your other protocols in place, the lunchroom probably would be one of the last places I would open up, even before conference room. Because you can have a conference meeting, staggered distance, and with your mask on, right? So you get your 3 out of 4 in a reasonably sized conference room because you're keeping your mask on. But once you start taking your mask off to eat and drink, that, increases the risk of the transmission. So I think the lunchroom is going to be one of the last places I open up. If you're lucky enough to have outdoor space nearby, go to the waterfront, have a nice outdoor lunch with folks, fantastic. If you can eat at your desk and stay more than 6 feet apart, great. But I think that lunchroom is going to be the last place where I let more than 1 or 2 folks in at a time and be like, get your stuff, get back to your desk rather than hang out. And if you want to hang out, go to one of the bigger open spaces. That is one thing. Quick show of hands, how many of you have a relatively open floor plan? Where most of your employees are in an open space. I actually can't see everybody, but because I know modern workplaces, we got all fancy and dynamic, interactive, workplaces where you can, collaborate easily, and even the executives sit out amongst the, other staff members. That makes it harder to do some of this distancing. Literally one of my clients has only one office. Only the CEO has an office. Everybody else, the whole C-suite, all the other employees are just out in big open rooms. So that's something we're dealing with, trying to manage that space, right? So, so that's again, that's kind of with the engineering controls of how are we going to manage our work space? Yeah, you can share a refrigerator, just wash your hands and don't eat other people's food. That's gross. All right. So this is a busy slide, but basically showing an example of sort of a cheat sheet that can be used kind of prior to employees entering the office. And again, believe me, this is actually the simplified version, believe it or not, because there are so many factors to keep in mind. But one thing to highlight, let me see if I can figure out my little pen thingy, is once you're fully vaccinated, whether you're coming from DC, from outside of DC, either for travel, either travel back and forth, or you're from here, no quarantine requirement, no testing requirement. These vaccines are a game changer, not only for protecting ourselves and our communities and our staff, just for protecting the ability to do business, right? If you have staff who frequently travel for work, to do business, for example, they're in the sales team or something, they really need to be vaccinated to just be able to do work. Otherwise, they're going to be sitting around for 10 hours or for 10 days, working from home when they're supposed to be doing business, right? So that's one group that we're definition of high risk state. Sorry, let me try to undo my pen real quick. For now, for DC, there's actually a couple different definitions. I'm pretty much going with anywhere outside of DC, Maryland, or Virginia for right now, just to keep it simple, because your employees are not going to be looking up who has more than a 10% positivity rate. That's not going to work for an easy protocol that's easy to understand. So we've got to make it simple, right? Keep it simple. All right. Yep, we're getting vaccinated to vaccine soon. Okay. Here's another poll. All right. So we've got a plan for who can come into the office. We've approved them for coming into the office because they haven't traveled. They're fully vaccinated. What's next? All right. So we should ask them some other questions. Here's our questionnaire. Do you already have an app-based screening questionnaire, a laptop or an iPad, kind of the front desk type of thing, a paper questionnaire, other or nothing? Okay. Great. Wow. I'm very happy to see this in a way, because it means this is a useful conversation we're having. Looks like I think most of us have voted. We could probably.
Yeah, I'll go ahead and end the polling and share.
Yeah, I think so. So about 29% have like an app-based questionnaire. I'm not endorsing any products right now, but if people want to put the brand they're using, that's great. You can share amongst yourselves in the chat. A laptop, an iPad, paper questionnaire. About 56% of you don't have a questionnaire, at all, as far as getting back into, or as far as screening folks before they get into the office. A lot of you might either have children you've had to fill out a questionnaire for, like saying, and it could be, a range of questions. I'm going to move to the next slide. Okay. All right. So a screening questionnaire. You can have a simple set of questions. I do not recommend the 10-question questionnaire every day for one of my daughter's schools, but you can really get to the gist of what you need to know about people before they come to the office with 2 or 3 questions. A question about, do you have any symptoms, and then list the symptoms. Have you traveled? And then I would say these are all customizable. So it's going to be time to tell my clients to add that third, like, are you fully vaccinated? And some of these apps are very inexpensive, like $1 per employee per month. We're not talking prohibitive costs here, and make your life so much easier as the person who's going to have to be checking those questionnaires. Some of them have functionalities for calendar, like, okay, we're letting 20 folks in on May 11th. People can sign up for their May 11th. They can do the screening questionnaire. You can get that information, or whoever the administrator that's chosen. It's kept confidential. Only the administrator, probably an HR person, is going to have access to that information. And it can just it's another layer to keep, anybody who has been exposed or is sick from entering the office.
You had some questions, Claire, in the chat.
Yeah, no, it's not anonymous because you kind of need to know if somebody snuck in, but it is confidential, between the person who enters it and the administrator, probably, the head of HR and HR assistant who is tracking that information. So it's not anonymous because that wouldn't be very useful, but it is confidential, if that makes sense.
And it should be done daily, correct?
I recommend daily. Just because, one, if you've ever had to take a medication weekly, it's actually easier to remember daily than weekly. And you can also go from having the sniffles to not having the sniffles, or not having the sniffles to having a sniffle or fever in a day. And, given we're still probably going to be hybrid for a little while, it won't be prohibitive. And then people are going to get used to it. So they can, the apps can often have a push notification, just at 7 a.m. be like, boom, don't forget to fill out your questionnaire, beep, 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 you're done. And that can be tracked. So that can be helpful information, just another level of safety. All right. And then of course, once you have that information, you have to know what to do with it. Sorry, my pen doesn't seem to want to go away. All right. All right, so we're now here. We're to next the next level. I will get to that question about OSHA shortly, because it's an important question. So we've allowed people into the office. We've screened them before they come to the office to make sure they're safe to come in. And we're going to add another layer, the masks. Masks are safe. They work. Anyone who's again, we talk about your 3 out of 4. If you're inside, at least through September or possibly December, I recommend everybody be masked. If you do know for certain that your group's vaccinated, you can probably have a small group inside or outside without masks. But for now, everybody inside the building should be masked, vaccinated or not. Let me make sure we get to vaccinations because we're having such good conversations. I want to make sure to respect everyone's time. All right. Vaccines are safe. Vaccines are extraordinarily effective. Virtually 100%, all 3 are virtually 100% effective at eliminating the risk of serious illness or death from COVID-19. That's pretty much unprecedented for vaccinations, okay? Even people get the varicella shot, a few will sometimes get a mild case. No, with decreasing with almost 100% of efficacy, eliminating the risk of serious illness or death, all 3 of the vaccines. And guess what? They're extraordinarily safe. People might be concerned about one of the vaccines having been on pause. The fact that that pause was triggered by 6 cases out of millions of people vaccinated is actually reassuring to me that people were keeping close track. So if anyone has questions about their particular personal, which vaccine they should get, they should talk to a healthcare provider. But in general, the message is vaccines are safe, vaccines are effective. Vaccines are much more available than they were. I had to take my husband to West Virginia to get his, or the border with West Virginia on the Maryland side to get his vaccine just a few weeks ago. And now you can go to the corner CVS, get it done. So they're safe, effective, they're free. In the US and in DC, about 50% of adults have had at least one COVID vaccination. We're getting there. We're talking about the medical and religious exemptions. As a healthcare provider, I'd be very hard pressed to find a legitimate medical exemption. I'll be perfectly honest. I mean, if you, because they're not made with eggs. So if you're allergic to eggs, there were a few anaphylactic reactions, but those are people who already had severe allergies in general. So anaphylaxis is where your throat closes up and you have trouble breathing. So those people would probably be asked to, bring some Benadryl and an EpiPen if they have it. But other than that, there's, if someone is coming at me with a medical exemption, chances are what they're calling a medical exemption is probably going to be a reason to get the vaccine. Diabetes, heart disease, history of blood clots. It's more of a reason to get the vaccine. You might choose a different vaccine for one versus the other, but it's important. All right. All right, let's do another poll. Are you planning to require vaccines or not? Either we do not have a policy and we're not necessarily encouraging, we're encouraging employees to get vaccinated but don't require it, or require a vaccine, or we have a policy encouraging vaccine, so encouraging plus incentives. What are you thinking?
All right, I'm going to go ahead and end the polling
Great.
and share the results.
All right. All right, we do not have a policy, nor are we encouraging it, only 10%. Good, that means 74% are encouraging but not requiring it. A few have already decided to require the vaccine. Perfectly legitimate option. And then only 3% are having a policy plus incentives. All right, friends, we might have to have a conversation here. All right. A couple questions about vaccines have already come up, and we'll keep talking about that. But the majority of you are encouraging, so that's good. But we might have to take people a step further to get to, back to a new normal. All right. Someone asked about, I've heard the vaccine doesn't work for some medical conditions. So not being as effective is different than not being able to take the vaccine. So it is not a live vaccine. So immune compromised people can generally take the vaccine. However, if they're immune compromised, like their immune system's not strong enough to mount a full court press of defense, yes, they might have less of a response. So they might talk to their physicians and get some antibody tests and see if they need a third vaccine or something to that effect. I don't think there have been enough of those cases to have a proper protocol yet, but that is definitely something that the medical institutions are keeping in mind. Ms. Rosenberg, was that your question, or did you have another one with your hand up? Samantha?
That was my question.
Beautiful.
I don't know why my hand is still up.
It's 2021, I'm just lucky I haven't stayed muted during the presentation yet. So, all right.
I do have a follow-up to that though, because if a doctor tells an employee not to get the vaccine, I, as the employer, am not going to question their medical exemption from the vaccine. Like, that's not my place. And as an employer, I would be concerned about the legal liabilities around it.
Right. Absolutely. Absolutely. The staff member should actually be reminded when they're getting that note that there's not a specific diagnosis, right, on the exemption form. It would not be like, oh, they can't get this because they have blood clots. It'd be, they have medical reason for not getting this vaccine. Okay. So yeah, you can't question like, hey, what, do you have an autoimmune disease or something? No, we all know that's not allowed. We don't need the specific reason that they can't get the vaccine. We just need to know that's a medical or religious reason. And that brings up something PJ and I were discussing earlier. Is like, well, how do we know if they have a medical or religious exemption? I see one, you are allowed to require the vaccine. Let me switch to my next slide. Equal Employment Opportunity Commission, Americans with Disabilities Act, as long as you give that medical or religious exemption, you're good. You can require it. Now, culturally, if your culture is not so much a didactic, like, type of place, you might decide to do more like strongly encourage plus incentives, except for particular groups. So for example, if I owned, a nursing home or home health agency, those would be a group I would be, encouraging, incentivizing, bordering on requiring. Same for travel, because those close interpersonal interactions and travel, if they're a key part of the employee's job description, then their inability to get that vaccine pretty much affects their ability to do their actual essential job function. So that where it might be where, if there's no accommodation possible, they might have to either decide, or if there is an accommodation option, of course, there's an opportunity for that accommodation. Back to the medical note. I think a medical note is a very useful tool. Why? Not because we're trying to be all like big brothery about get your doctor's note like you do for, your kids for school. No, but to give that employee another opportunity to speak with a trusted person that can encourage them and explain to them and reassure them and address their concerns. You're not your employee's healthcare provider. You are their human resource person. Their healthcare provider can be a trusted person. So if you say, you better go to your doctor and get that note, that's another interaction, another opportunity for them to be encouraged to get that vaccine from someone they trust. Okay. So, and I think honestly, having the doctor, unless they're Christian Scientists, do the religious exemption is fine too. If I'm a healthcare provider and someone tells me my religion doesn't allow me to get this vaccine, I'd probably do it. I'd say religious exemption. Okay, fine. If I think it's legitimate, and if I have a relationship and know that patient, I'll understand where they're coming from. I might also encourage them and ask, so why do the healthcare provider can ask the specific questions, right? That's, protected relationship. It's just another opportunity for that employee to make, to get that job. Oh, PJ?
Yes.
Yeah. Oh, did you have a question? Or were you going to just have me?
I'm looking at the questions in here. Questions about what do you say to an employee that is waiting on getting the vaccine because of concerns about quick turnaround of the vaccine production? Someone also asked, when should an employee look to be vaccinated if they've already had COVID?
Those are important questions. So the employee is worried about how fast the vaccine was rolled out. One, this is research that has been done for 10 years on different similar viruses. COVID-19 is a new virus. SARS-CoV-2 is a new virus. Coronaviruses have been around a long time, and we've known about them and studied them a long time. Some of them cause a common cold. I remember from my microbiology 101 class, mnemonic image of a Corona bottle to learn about coronaviruses. No joke. Unfortunately, became a bit of a joke earlier in the year. But that is to say that coronavirus has been a long time. We've been studying them for a long time. The tools to make these genetically specific mRNA pieces has been worked on. I'm older than I look. I worked on some stuff with the Genome Project back in the day. This has been going on a long time. So even though we were studying SARS-CoV-2 for just about a year, the vaccine work has been done over a decade. Also, now over 120 million Americans have already gotten the vaccine, and we're tracking it, and we're getting very, very few serious side effects. Sure, some people might feel a little icky for a day or two, flu-like symptoms, things like that. As far as serious side effects, there's so few that it becomes news. Let's put it that way. Yeah.
Can it be required, the vaccine be required during this emergency authorization status?
That is a question that has come up, and a month or so ago, I might have said, "Ooh, let's just wait till it's finalized." But so many people are vaccinated, and it is so essential to people to be able to get back to work that even the Equal Employment Opportunity Commission says, "Yep, you can require it as long as you have those exemptions." So culturally, you may want to more incentivize plus, encourage and incentivize. But if it is an essential function of your folks to be with the public, you're allowed to require it. So cash incentives have been in the news. Maryland's gonna offer $100 to their government employees if they get vaccinated. They're serious about this. You can have a raffle. You can offer PTO, because I have not seen the data, but I have a concern that some of these more vulnerable communities, they're, hourly employees who, might be living paycheck to paycheck. I don't think it's just hesitancy. I'm worried about the microchips and the vaccine or something. I think a lot of it is they're worried they're going to lose a week's worth of paychecks because they've heard their friends, felt flu-like symptoms for 2 days. So if they lose 3 days worth of a paycheck, for some families, that is burdensome, right? So I think that's where employers and society have to recognize and really meet people where they're at. What's their concern? What would help them get vaccinated? Because there's, as a healthcare provider, I'm concerned about there's healthcare workers who are reluctant. And I don't think it's just the historical relationship with the medical profession. I don't think it's just the Fox News. I think it's multifactorial and goes beyond just hesitancy. Okay. So I think meeting our employees where they're at, or encouraging them to talk to their healthcare provider is going to be an important part of this next process.
Another question that came in, I know we're already at time here, but certainly important questions that I know people are appreciating the answers to. Another question in the chat was asking about those being vaccinated. How do you respond to those that are vaccinated who are uncomfortable going into the office with people that are unvaccinated?
So I think that's a question that each team is going to have to answer for their, each leadership team is going to have to answer for their organization. One, work on, that employee is not the concerning employee to me. It's the other ones who are not vaccinated. I would spend my energy working on those unvaccinated ones. And meanwhile, reassure that employee that we're working on getting those folks vaccinated, but we have the other layers. Remember, you get your 3 out of 4, you know, everybody's masks, distance, you know, and you're vaccinated. So the vaccinated person is very safe. Even the public transportation conversation we had, if you're masked and vaccinated, you're pretty safe, even in that more concerning sort of environment. But remind them that we have other layers of safety, and they can make sure they take care of themselves with keeping their masks on. And of course, if there's someone who's really concerned, you can work on a policy for like, okay, we can allow remote work until we've got over 50% vaccinated, things like that. You know, there's ways to work with that because, you know, we want to take care of our team. We want to reassure them, you know, that they're coming into a safe environment. All right, so we're already kind of in a Q&A. But I'm going to, since we're at time, you know, anybody who needs to leave, thank you so much. I'll make sure that PJ sends out my information if more things come up, but everybody who wants to stay on can totally stay on, because I'm going to go over a few, you know, wrap up items. Mental health ties into what we were just discussing. Our entire globe has been through a common traumatic experience. There's been loss, there's been isolation. So we all need to work together, and we as their leaders have to work to make the transition as safe and reassuring as possible for them. So again, it goes back to having a plan. That anxious person is like, I'm vaccinated, but I don't know about so-and-so. One, it's not your job to tell them who is vaccinated or not, remember. But that person might be the person who actually reads the 10-page document that you and I work on together, you know, like that, instead of just the summary email. And if they know that you have a plan that has masking, that your ventilation is at MERV 14, and they're not letting people eat in the lunchroom, they might be like, okay, I think I can swing that as long as I keep my N95 and my face shield on, you know? And then making sure that your employees know how to access like employee assistance programs and virtual counseling and support services, provide opportunities to socialize, like outside and masked, you know, and after work, informal happy hour. I would actually encourage it to still be informal, so that if people misbehave and take their masks off, you're not liable, but that's a little more in the weeds. But allow some flexible scheduling to take into account that elderly parent, that kid, that pandemic puppy, like how, you know, recognize that people are human and their lives have changed a lot, and they may have lost some of those support systems that they had prior to the pandemic. If people are worried about their job stability. Oh, PJ, could you put my info in the chat? Well, that'd be great. Thank you. And then gradual return. I don't want you going from 0 people in the office to 150 people in the office in one day, please. I think you need to do some small groups, get people used to the protocols. We don't want 150 people sitting at that iPad at the front door. That defeats the point if you're all congregated waiting to, you know. So having a couple pilot days, trial runs, back to the office, you know, small meetings, small groups, that gets people used to their routine. Oh, I forgot how long it takes me to drive or get on the metro to work. Oh, I forgot I don't have any clean clothes that fit me, that were work appropriate, because I've been wearing yoga pants for a year. You know, help people give people like a chance to kind of come back gradually. And then, do you guys have ideas about like things you're thinking about as far as people's mental health? You can just chime in real quick. You know, if anybody needs to go, they can pop off, but. All right. All right. And then this is just a summary slide of like things to keep an eye out for. OSHA has guidelines on their website, but they're about to come out. They've been compelled by the Obama administration to come out with more specific and enforceable guidelines. So that's a place to keep an eye on, because before it was sort of like vague, we can kind of recommend you do this. Now both DC and OSHA are coming out with more specifics. And then DC and New York are both starting to require their government employees to come back at least part-time. All right. So some of you all might work with DC government. So that might come up in your place of work that, oh, Ms. Smith, I usually call down at the DMV. She's actually in person. What? Like, she wants me to come into a meeting. So those are kind of things you're going to be seeing as people are trying to bring their employees back. There's, you know, unemployment, paid time off, those things, those policies are evolving these days. Masks, vaccines, and just, it's important to keep up to date because, you know, PJ and I were literally just talking like, oh, I think it's 250 people allowed in DC, but I think they may have started to waive that and just had to keep spacing, right? All the information is evolving continuously. So keeping up to date with that and getting help with keeping up to date on that are important. All right. How can I help? All right. I am a public health consultant in occupational health, specializing in COVID-19. So I can do a range of services for you and your organizations. I can help from the A, you know, develop and write your A to Z, comprehensive, customized return to the office protocol. I can do tours and help you figure out how many people you can fit into your workplace. I can also do more like review what you already have and help you update it. Just, you know, oh, we already have this document written by lawyers. Can we have a set of public health eyes on it, please? Or help with training. Say we already have this plan, but it might be nice to get a fresh face to communicate with our team that they haven't been seeing on Zoom for a year and a half, both in person and I can do that in person in the DMV area or virtually anywhere. I can even come back to your first day of work if you want me to just be there and like observing the flow. I can help you develop screening and testing protocols, help you figure out which app to get. I can also just be available for those what ifs. They're like, oh, Claire, so-and-so, they were exposed, but they've had one shot. What do you think we should do? Or, you know, so-and-so came into the office and actually, you know, has COVID, got, you know, hopefully not, but I can help sort of be the on-call. Believe me, I have probably have a few texts while we've been on the phone from some of my clients, just checking on like, you know, what they should do in different, you know, extenuating circumstances. So I can just kind of help be your on-call occupational health team. Yay. And this is my contact information, and PJ put it in the chat. We'll send out an email later with some, probably a little eval and a little bit of a handout. So if people have other questions, they can just put them in the chat or shout out, or you can email me later with them. I'm really grateful to PJ and to all of you for being here today. Thanks for your patience. It was so dynamic that we went a little over, but not by too bad. Let me stop the share real quick. All right. So anybody have any like insights that came up with today or things like want to follow up on? Let's see. Just watching the chat. Oh, Linda raised her hand. Is it still there on purpose? Do you want to unmute Linda, or was that like a leftover hand? All right.
I think we're good, Claire. Thank you
so
much for joining us today. We certainly do appreciate it. And I will absolutely be sending out a summary with some information, obviously, of all of this information, as well as any of the resources that we talked about during it. So thank you again so much for joining us. And we hope everybody has a great weekend. Thanks so much.
Take care. Be well all.